morning. Welcome back to the Retirement Report. I'm Hank Parrott, your host. All right, joining me today, Warren Cranford. Warren is a benefits specialist and can help you with Medicare supplement plans, Medicare Advantage plans, trying to sort through. There's so many of them out there to sort through to find the best plan for you. Open enrollment, October 15th. That's tomorrow. So this is a good opportunity for you to review your current plans. And for those that may be just getting started even, of course, this is always a time to get a little advanced knowledge. If you're going to be turning 65 sometime even in the next 6 to 12 months, probably a good idea to learn more about that, start doing your homework now so you're prepared when that time comes. You know, original Medicare, we want to cover again what's not covered by Part A and Part B. This is your original Medicare, so your hospitalization is Part A, of course outpatient is Part B, and if we can get that chart up there, or excuse me, that slide up there, original Medicare does not cover, by the way, all health care services. And this is just a list of some of those things most notable, if you will, exclusion from that. But there are others. And unfortunately, most Medigap plans don't cover these services either. Right. So one in particular I'd like to call is long-term care. We're going to talk a little bit more about it, but basically understanding that typically, give you an example, someone goes into a hospital after having a stroke, let's say, and they're in a hospital for 3 or more days, which is typically even longer, of course, and then they go to a rehab facility. There's where your long-term care is kicking in, up to 100 days. Can be covered by Medicare, up to, and that's the key, is that if you're showing progress, if the combination as far as your the caseworker and the providers, the medical providers are all in agreement that this is working, you're improving, you can get up to 100 days of coverage for those services. After that, you're going to need a long-term care policy or privately pay to cover those expenses. So something to keep in mind. Long-term care, again, for the most part, is not covered by Medicare. Now, one exception would be if you're, let's say in that scenario I gave, now you're finished rehab and they send you home, and you get home, but you still need some skilled care, maybe a speech therapist or which I could use most of the time, maybe an occupational therapist, respiratory therapist, whatever it might be. Skilled care would still be covered under Medicare. But custodial care, if you need help because you're not able to do the normal activities, maybe it's just things like housekeeping and meal preparation and maybe you're not able to drive yet. You need someone to take you to doctor's appointments and run errands for you. All of that's considered custodial care, is not covered by Medicare. You would need either private insurance or private pay to cover those costs. And this is one of those areas, Warren, I think that if you would, that list of exclusions, just to kind of touch on those as we go, in particular like dental and vision.
Yes, so as you see, most dental care, most vision care aren't covered under original Medicare. And so when folks if they have original Medicare and they have a Medigap or supplemental policy, they are able to add standalone private insurance plans to help cover those benefits if that's something that they're interested in. So they do have an option if they choose to go that path. But it's very outside of that. There's
so now you're talking about, so they'd have like original Medicare with Part A, Part B, and then you're going to have a Medicare supplement plan, and then you can go out and get dental plans, vision plans, hearing plans.
Correct.
But that'd be now another separate cost that you would incur as well.
Another premium, potentially another private insurance company that's a completely different company from your drug plan as well as your supplemental plan. That's correct.
So this is one of those areas where when it comes to comparing original Medicare with Medicare Advantage, these are the exclusions with original Medicare. Let's take a look, Warren, at a Medicare Advantage plan, also known as Part C. Okay. What that covers compared to original Medicare.
Yeah, so Part C, I think some of the misunderstandings about Part C is that they provide everything that are required to provide, everything that original Medicare provides. And Part C, which is the Advantage plans, is a part of original Medicare. So it is just a branch of the 4 parts of Medicare. So Advantage plans are private insurance carriers that are under contract with the government, and they are they're regulated. There's standards that are set by Medicare that they have to meet and match. With the Advantage plans, there are quite a few plans that offer zero or very little premiums, and they have co-pays that are considered manageable. Some co-pays may be zero, but other co-pays may be, depending on what the benefits of the services are, can be a little bit, $100, $200. Just depends on what it is that a person's going to have done. But there's a lot of screenings that are provided through Advantage plans that have a zero copay that's covered also by Medicare, so they include those in those Advantage plans. The thing about Advantage plans are, when people talk about the differences between a Medigap policy, supplemental policy, as well as in comparing that with an Advantage plan, is that Advantage plans are subject to potentially counties within a state, and especially state borders. They typically do not travel across state lines. Then when a person's traveling and they're on vacation, now that's one thing. There's always emergency room services are available no matter what Advantage plan or where you're at within the United States. But and there's urgently needed care that's typically covered, but you would just need to communicate with your Advantage plan carrier to find out where you would need to go. But outside of that, most people go on vacation, things like that. They come back home and they take care of whatever it is that they may need to have dressed back at their residence and stuff in their area.
And there might be some plans out there that have, like for snowbirds in particular, that go to Florida. There may be some Medicare Advantage plans that would cover both of those states, but to your point, for most people, if travel is a big one, if you're going to be traveling, across the United States in your RV or whatever, I've got one client that did that on his motorcycle. He wanted to hit all the states in the continental United States, and as part of his retirement. So in his situation, if you're going to be out on the road all the time, going from state to state, then original Medicare is probably going to be a better choice for you than a Medicare Advantage plan, which is more usually geographically limited.
Correct.
And for most of us, though, that just take maybe the occasional, take vacations, we're doing travel that way for, whatever it might be, 2 to 4 weeks out of the year, that's not going to be, either one of these are going to work for that, because as Warren said, you've got your emergency services, including foreign travel. Now they do recommend travel insurance, and that's whether it's original Medicare or Medicare Advantage, in particular for foreign travel. So, but for here in the continental United States, if you're going to be moving around a lot, rule of thumb, probably better with original Medicare. If it's just the occasional vacation or the travel that we typically do in retirement, where it's a few weeks out of the year, give or take, there it's probably not going to matter. You could have, again, either plan would be suitable. Biggest thing, again, to take away here is that you get, with Medicare Advantage plans, whether you're taught, vision, dental, hearing, a lot of the plans will incorporate all of that and more. And Warren, this is going back to Part D. First off, with Medicare Advantage, the Part B premium that you're paying is going to still be paid, whether it's an original Medicare or Medicare Advantage plan. Same with Part D, though with a part on the original Medicare, that is, but on Medicare Advantage plan, that can somehow, or sometimes you can get prescription coverage included at no additional cost, or if you want, you can get even better coverage for prescriptions at an additional cost. Is
Correct.
That fair?
Yeah. So and oftentimes with Medicare Advantage plans, some of the differences are there are no health deductibles, no drug deductibles. Whereas I was mentioning a few minutes ago that $505 drug deductible that's going to be effective as of 2023. With an Advantage plan, they are typically those plans typically waive those deductibles, and so there's no health deductible, there's no drug deductible, and things like that. So, and sometimes, depending on formularies, folks can, depending on the medications and formularies, there's no guarantee, but potentially sometimes they can save money in with their medications if they have a Medicare Advantage plan that has that drug benefit that's a part of that plan.
This is why it's so important to shop these plans, and it's a good time to do it. And then, of course, this begs the question, which is better, original Medicare? I mean, we've kind of covered caveats. If you're going to be traveling, for instance, a lot, if you're going to be seeing the United States as part of your retirement, traveling around an RV, or as I mentioned, my friend that does the motorcycle, whatever it might be, that's where original Medicare may be best. But there's going to be exceptions to everything, and we're going to talk about, as soon as we come back from this break, which is better, original Medicare or Medicare Advantage? Probably depends, right? Join us here. We'll be right back on the Retirement Report.